Let's talk now about trying to boost those vaccination rates. Now, vaccination rates have been dropping, but the White House, is hoping that using barbers and hairstylists in the Black community might fix those numbers. We're joined now by Dr. Reed Tuckson, co-founder of the Black Coalition Against COVID. Doctor, great to have you here with us. So I want to start with some context setting. Give us the lay of the land right now. We know that the pandemic disproportionately impacted the Black community, but a lot of efforts have been made to increase testing and also to increase vaccinations in Black and brown communities. Where do we stand right now in terms of vaccination rates for minorities?
It's a story of good news and bad news. The good news is that we have been very successful at getting a significantly large number of the African-American community to overcome the traditional distrust that so many have with our social institutions and have them actually becoming vaccinated. The bad news is we still have a ways to go. And so that's what we're trying to do now by using every asset at our development and at our disposal. And particularly as we look at the life of the Black community, we know that it is characterized by two important factors. Number one, our relationship to our faith and our relationship to our barbershops and our beauty salons. We spend a lot of time in beauty parlors and salons, not just to get our hair done, but because they're cultural institutions in our community. It's where we transmit information. It's where we share our values. It's where we argue about who was the greatest basketball player of all time. It's the place where we gather. And so that, along with using our ministers, are going to be two very important ways that we have the conversation with people to help them have the correct information that overcomes the misinformation that's being permeating through our community and let people make personally appropriate choices and decisions based on facts.
Dr. Tuckson, it's Brian Chung here. I want to ask about just where you see the progress so far. We've been hearing a lot of the concern about whether or not the Black community could be getting vaccinated at the rates that the larger American community is getting vaccinated. Now, we're obviously many months into this vaccination campaign nationally. Are you satisfied with the progress, or do you feel like now that we're getting this point of diminishing returns where every new person getting vaccinated is that much more of an effort compared to the last one in terms of getting closer and closer to that 70% line that the president is hoping for?
I don't think that any American could be satisfied with where we are as a nation. There are still far too many people on the conservative right who are not vaccinated, and there are too many people who are African Americans and other pockets. So I think where we are now is we all recognize, and the president, I think, is providing just the right leadership, that we've got to have all hands on deck focus here, and we've got to be focused on specific targets. We've done with the blanket messaging. Now we have to go after very specific targets. And that's why I think this initiative that we are launching, and which the president has supported, called Shots at the Shop, which is really now engaging the combination of African-American academics, medical societies, and the private sector. We're involving now the company Shea Moisture, which is putting in $1,000 for every salon that registers to be trained to be health advocates to talk about the facts about COVID vaccination, and then have them become sites where the vaccinations can actually occur, bringing all of this right to real life where real people gather. And so I think it is now time for the private sector to partner with physicians and academics to be able to work with things like barbershops and with faith congregations to now provide those kinds of incentives for them to be able to do what needs to be done to close out this last stage of the struggle. Let's keep in mind, there is a lot at stake for this nation if we don't get to the numbers that the president is trying to reach by July 4th.
Dr. Tuckson, I do want to ask you, because I first heard about this initiative, I'm going to admit it, on Instagram, on the Shade Room. And I decided to go back today and read through some of the comments just to do a bit of a temperature check on how folks are reacting to this news. And I have to say, it wasn't entirely positive. A lot of folks very skeptical of the fact that they're being pushed to get the coronavirus vaccine in a barbershop when the U.S. government still isn't providing insulin, for example, for free. That's a disease that we already know is overrepresented in the Black community. Curious to know how we can boost these vaccination rates without making systemic change in a healthcare system that has caused so much mistrust in the Black community. Do you think those two things really need to be done in tandem for these initiatives to be effective?
There is no question that two things come out of your point. Number one, that the organized anti-vaxxers are very good at what they are doing. They target every time we do any initiative, and I've been at this now for a year, unbroken. Every single time we talk about anything, whether it's masks or vaccines, these folks are out there organized to try to kill you off. There are just some very mean-spirited, immoral people out there in the world who are very well organized. So I'm not dismayed by that. But their larger point that is key here is that this distrust that people of color, unfortunately, have hard earned by their relationship to our society is vital. However, we don't have time to wait for that whole train to turn around. We have to keep fighting that fight. But in the interim, we're trying to save people's lives. There is so much at stake. And so what I would say to you is that while we need to get at those bigger issues, we need to focus right now on getting as many people vaccinated as possible so that we can protect these people. Think about these essential workers who are out there on the front lines, who have no idea whether people are walking around without masks, whether they are vaccinated or not, or whether they're carrying this virus. We are exposing thousands and thousands of our fundamental workers to risks that they cannot even calculate. If we can't get them vaccinated, I am terribly fearful, particularly with the variants that are spreading around the world and now into this country, that we're putting their lives at risk. I pray and hope that they don't get sick and they get vaccinated in time.
All right, Dr. Reed Tuckson, co-founder of the Black Coalition Against COVID. Thanks so much for joining us.